We look at hemophilic bleeds and also acute hemarthrosis. Hemophilic bleeds and acute hemarthrosis that are linked up, It has to do with, bleeding in the joints, causes a lot of inflammation and, the joint is not, it's not good again. It's kind of like spoiled. So in hemophilia, usually it occurs in hemophilia. That's people that have tendencies of, joints bleeding so much, joint inflammation so much. It occurs there. So it occurs in, okay, there's deficiencies of what? Clotting factor 8, clotting factor 9. It leads to a lot of bleeding episodes where there could be bleeding in the joints too. So there could be bleeding in the joints. So that's what we're actually concerned as orthopedics, So pathophysiology, there's clotting factor deficiency. So there's impaired coagulation. So joint bleeding, so there's so much bleeding in the joints, the blood will accumulate in the synovial cavity. So there's also inflammation. The synovium becomes so thick and fragile because of the repeated bleedings. Cartilage damage. So over time, there's damage to the cartilage that overlines the joints. You understand? So clinical features of acute hemarthrosis is sudden onset of painful swelling in the joint. There's warmth and tenderness over the joint. There's restricted movement. Have irritable joints. Then recurrent bleeds. This person is bleeding frequently. So diagnosis is clinical suspicion first of all. The person is bleeding anyhow, so you are suspecting that, if you aspirate the synovial fluid, it will stain with blood. Imagings, you see that there's early synovial hypertrophy and cartilage damage. Then lab tests will try to now assay for the blood clotting factors that are missing. This will now help you to confirm that, okay, the person actually has a hemophilia. Management is what? The blood factor that is missing, you try to replace it. That the person should rest, you ice the place, you compress, you elevate. Pain relievers like NSAIDs. Physiotherapy, early mobilization after bleeding subsides. Then surgical options like synovectomy, also joint replacement surgeries.